I rose to speak on the Health Legislation Amendment Information Sharing Bill 2021. Under this bill, as it stands, a new system will be created allowing a person's private medical information to be shared between hospitals and health services without their consent. That's key here, and I'll be talking about that quite a bit through my contribution. This bill amends the Health Services Act 1988 to create and maintain an electronic health sharing information platform to share information between hospital and health services. It intends to address challenges associated with accessing patient health information. We have been told information is currently spread across different health services in different databases and in paper records. This statewide collation of patient health information intends to create a more efficient, safe and more secure method of sharing health information between services. However, there is a flip side to that. There are genuine concerns that exist in the community around privacy and the inability of patients to opt out of this system, which are worthy of discussion today. Firstly, there is no list in the legislation of exactly what information will be included in this new database. It is assumed it will include all information about patients and their previous treatments, medications, allergies, discharge summaries, outpatient consultations, lab and image results, and other information deemed suitable by the Department of Health. The bill makes it mandatory for health services to adopt the new system, including but not limited to ambulance services, hospitals, public health services, community health services, the Victorian Institute of Mental Health and aged care facilities. It is the Secretary of the Department of Health that is responsible for establishing and maintaining the new information sharing system, and the Secretary is empowered to specify the health information required to be contained on the system, direct health services to provide prescribed information to the Secretary, and disclose specified health information for the purposes of the new system without requiring consent. Again, those words, without requiring consent of patients to whom the information relates. If passed, as is, patients would have no ability to opt out of the new database before it is proposed to be launched in February 2023. Victorians would lose control over access to their sensitive information and would have no control over what parties and agencies are accessing that information. It essentially gives health professionals complete authority over our medical information. There is nothing in the bill that prevents health information that's not relevant or appropriate from being seen by treating doctors. It allows specified persons to access the database. To put it simply, it allows agents of the Victorian Government to view a complete record of every Victorian's most sensitive and private information. We saw something similar when My Health Record was introduced at a federal level. That is the National Health Record system that has been around for some years now. The difference with My Health Record was that there was a period of time during which people could opt out. Everyone would have a My Health Record unless they opted out, which allowed people to have control over where their information is stored and who can access it. More than 2.5 million people withdrew from My Health Record when it moved to an opt-out system because not everyone wants their health information being shared around. A further 300,000 people cancelled their records. Under this system, there is no opportunity to opt out. We know this is the government of mandates, and yet this is another mandate scenario as far as I can see. Hospitals and health services have no choice but to opt in, and everyday Victorians have no choice but for their private health information to be available in this database. This includes current and historical mental health information, and people will not be afforded the benefit of a list that shows exactly who can access this information. It doesn't appear like there are many limits or regulations on who can access it. One section of this bill states that a person employed or engaged by a health service who is authorised may access the system and use and disclose patient information for the purpose of providing medical treatment to the patient. There is a long list, not in this bill, but hypothetically, of health practitioners and those outside the health system that could end up with access to this information. With My Health Record, people are able to control access to documents by restricting access to certain documents by putting in place access codes. People can also remove documents completely and request their entire record be deleted. None of these options that give Victorians the right to control and consent to their information being shared are incorporated into this bill or this new system. What happens to people who want to keep their health information private? There are people who are concerned that information may be available to their workplace or others and may become a reason for discrimination. This bill imposes fines for unauthorised access to the system, but is that really enough to stop the urge for some people to look up files that they shouldn't? The Royal Commission into Victoria's mental health system recommended we adopt a system that allows for mental health information to be shared. There are obvious benefits in health practitioners having access to a complete health record in times of patient crisis. It becomes much easier to support and treat someone when they have an understanding of their background and their triggers. However, the flip side to that argument is, of course, the people who do not go around openly disclosing their mental health struggles. There should not be shame in addressing and overcoming mental health struggles, but for many there is. Where that information becomes accessible to everyone in the health sphere, it opens the door for discrimination. While I can see the obvious ease in having a central system, there are some people who prefer to keep their health information private, especially mental health. If people become worried that their mental health information will be accessible by a range of people, they are less likely to be forthcoming in seeking help. That is the last thing we need right now. We are currently living in a shadow pandemic where mental health of Victorians is severely impacted by lockdowns and the associated impacts. We need people to be confident to come forward and seek help. They should have the right to decide if they want their information shared. Another concern I wish to touch on is data protection and security. There have been numerous cases of security breaches in recent years. There was a time that 30,000 Victorian public servants had their personal details downloaded by an unknown party when the system was hacked. And again in 2016, when it came out that the Department of Health and Human Services had been breaching the privacy and safety of children in foster care by giving access to dangerous parents. The potential for mishaps with data are huge, and they have extraordinary consequences for victims of these data breaches. While the bill imposes fines for unauthorised access, a fine is not a strong deterrent, and fines are a reactive penalty in the sense that they are issued after the harm is done and after the breach comes to light. These are not protections from unauthorised use, and that is a serious concern. For victims of family violence in particular, there need to be proper safeguards in place, and at this stage we just don't have the information on how the system will work. Implementing this database will require both money and planning, yet the Victorian state budget that was handed down on the 3rd of May had no provision and no provision seems to have been made for this project, so I'm not sure where the money is coming from. It hasn't been outlined yet. We have not received any information about when the project will be complete or whether it will be compatible with the systems used in other states and territories. If we are going to the effort of creating a new database, it would make sense to make it compatible with other systems for Victorians to move interstate to reduce any issues in tracking down records. Overall, there are many unanswered questions. How will we manage access to information other than by saying there are penalties for wrongful access? How will we monitor how and when people are accessing the data and for what purposes? How will we protect the system from cybersecurity attacks, which seem to be happening more frequently, and particularly towards government departments? There are endless questions that we do not have answers for at this point of time, and that is why I am supporting the recommendation that this be referred to the Legal and Social Issues Committee, of which I am a member, for further analysis, which is definitely needed. There is no harm in an additional level of scrutiny and consideration, and given there are so many questions that remain unanswered, and given the implications of this bill if passed as is, and the privacy issues for Victorians, yes, it really needs to be referred to the Legal Issues Committee. I will leave my contribution there. Thank you.